Barkin's on the tape this morning saying that 29% of the stimulus was spent, 35% was put into savings or debt payment, right? A lot of that money just went into building a cushion for households because they didn't know what was coming either.
Well, who knew that things could get somewhat under control in some areas by wearing masks? Who knew that the people who still think that masks don't matter, those people are they're Luddites, and they are, frankly, the world is flat to them. But I do think that we've made a lot of progress. I think the therapeutic is good. I don't think the Lilly's such a setback. I think people are feeling brave, more brave. But I just worry about the cold. I worry about flu. I mean, look about all the people how many people used to sneeze on you all the time? David, sneezing on you means you're going to the hospital.
Well, it doesn't. And if you're wearing a mask and the other person is wearing a mask, you're in a much better position.
True. Thank you for saying that and correcting my hyperbole. It was hyperbole, David.
Yeah. I can see that our producers are putting something on the screen here that I guess they want us to talk about this exclusive Reuters story about some manufacturing issues at Lilly. It doesn't necessarily have to do with anything with the trial that they halted yesterday for their antibody cocktail. It relates separately, but Jim, we're getting closer and closer every day.
Yes.
We're going to hear from Pfizer. We're getting closer. We know Regeneron, actually, it's not a drug, of course. It's a company that makes the antibody cocktail as well, that the president used to great effect, it would seem. We know those are getting closer. Lilly did pause, but we assume they will resume. There'll be some availability. Bill Gates, you heard him talking to Becky Quick earlier. There will be some availability of these therapeutics fairly soon. Let's listen to what Mr. Gates had to say in terms of how things are going to roll out over the next few months.
As we worked with all the different antibody companies, we ended up picking Eli Lilly as our partner. And so that antibody's gone into the factory we reserved, and it'll be until March before we have substantial volume coming out of that. In the meantime, Eli Lilly has offered up 100,000 doses once they get approval that will go to the low and middle income countries. And so we'll learn how to do the delivery as that factory capacity we have ramps up. So we're very excited about that. We hope that the safety, efficacy, all these things get cleared because it could save hundreds of thousands of lives.
Jim, that was fascinating to listen to him. And he is so knowledgeable and obviously talks with Anthony Fauci a great deal as well.
Right.
So knowledgeable in terms of infectious diseases, which has been a focus of the Gates Foundation for years, prior, of course, to this pandemic.
Well, look, one of the things that David Ricks has to do at Eli Lilly, he has to talk about the mobile vans and how many lives he's saved with his therapeutic in nursing homes, senior living. I'm surprised he didn't do that. I know he's not going to brag on a day when the feds are saying that maybe his factories aren't good, but this man has saved a lot. Lilly has saved a lot of lives with his therapeutic already. This is not some experimental drug that has not been used, but it's the nature of Eli Lilly. Perhaps it's Indiana and the way they are, meaning that they are hardcore people who do not promote themselves. I'll promote David Ricks. Carl, this thing has worked and saved many lives. It's not like it's just like one person has been hurt. They have helped a lot of people. He should come on. He should call in right now because he's working remote. David Ricks, not David Faber. I don't look up. David Ricks, please call in right now because I know how much you've done to help people in nursing homes.
Jim, it's a good point because so much attention this week on Lilly and AZN and J&J and some of these pauses.
Shepard Smith here. Thanks for watching CNBC on YouTube.